We want to thank you all for taking time to be with us this afternoon. Um, as you come in, we have a lot of things going on right now. And I want to invite you all to drop into the chat a song that is inspiring for you right now.
We were asked today to host a conversation around racial healing for us to dive deep into that. And we felt that one of the ways that we can do that is not only talk about racial healing, but experience racial healing. So today is going to be part of an invitation. And we're doing this strategically because we acknowledge that you can't think your way out of trauma. You can't think your way through healing, that if you truly want to heal, you need to feel. And one of our maestros really grounded us in that. So we're going to invite you to sit with us, to share with us, and to just be with us. I really want to bring in one of our mentors and maestras. Some of us know her as Laguanai, some of us know her as Liz Medicine Crow. And she truly talks about the shortest distance between two people is a story. So today we're going to invite you to share your story. Who are you? Who's here with us? And we're going to have some of our co-facilitators really take us through that process. But I at least wanted to set the stage. One of our maestros, Jerry Theo, talks about racism is the disconnection. When you're disconnected from a person, it justifies you treating them wrong. It justifies you dehumanizing them. So if we want to really talk about racial healing, then what does that reconnection look like? Not only to one another, but sometimes that reconnection is to ourselves, to our traditions, to our heritage, to our ancestors.
So there are 11 touchstones, and we're just going to take a few minutes right now to just silently read the touchstones to yourself. And as you do that, I just invite you to pay attention to your own inner wisdom and what the touchstones are inviting us into, and just noticing, right, our internal conversation that comes up for us as we read through them.
Yeah. Thank you, Cecily, and thank you, everybody. I'm really enjoying the slowness that we can share together. I think that's one of the things that we were hoping for as we planned this. And so the first thing that we'll do before we get into dyads is we'll learn the question that's going to prompt our story. And you're going to be in dyads in a breakout room with one other person. And as we go through this, we ask that as one person, you get into your dyads, you can decide who's going to go first. But when that person is telling their story, that we're silent. We're silent listeners and we're engaged. And we can hold our me toos, yes, till the end, and be able to share that in our story. So that's one of the things that we want to focus on when we are in the dyads, is that, like the touchstone says, we're listening as much as we are. We're putting as much energy into listening as we are into talking. But we always want to model as well. And so our first question, we're going to put it in the chat, but who showed up today? And maybe you could also add in, who do you dedicate this time to?
Yes, welcome back, everyone. I hope you had deep, fulfilling conversations. Quick reflection after those conversations, and then we're going to go back into breakout sessions with a few more prompts. But I invite you to share in the chat, what was it like to be the listener in your breakout groups? What did it feel like in your body to be the listener? How did you quiet your mind if it was running? How did you open your heart? How did you live into the touchstones? So not trying to overwhelm you with different prompts, but what was it like to be the listener?
I'll go. Thanks, Ian. I hope you can hear me okay. Okay. So for me, it was really nice, being a mom and a wife and a nurse and researcher. I'm always putting myself in positions to have to receive and then respond to something. And so it really is nice to hold space to sit back and simply just listen, not with the expectation of needing to respond, and being there to hold space for someone else. And I forget that service and support comes in many forms, and it's one of those forms. So thank you.
And this time we're going to invite everyone to share a story of a time when your full-hearted self showed up. What happened, share a little bit about the context of that, and then how did it feel?
Please.
Awesome. Greetings, everyone. Christian. I love the fact that we are consistently going with the participant from last time. So Steph, huge shout out to Steph. So the sharing, the comfortability is there, the trust is there. And so this question, I was trying to think like this is random moment back in history's time when I was just like, you know what, it's not a trick question. I'm trying to show up as myself every day, you know? And so I just thought about it yesterday, and how myself and Steph together work around youth development, leadership development for our young adults. And just goes back into just like how I think everyone on this call, when we talk about healing, and what does it look like in the future for our youth and young adults. And so I want to give a huge shout out to my partner, Steph, in relations to just the last time of our last conversation to now, and how it's just developing. And so we use similar stories and similar anecdotes and whatnot. So yeah, it was a great sharing session.
Hello, everybody. Thank you all for the group for an amazing time spent. I would like to introduce our group, but before I do, we said we would be nimble to this process. There's a question in the chat that I'd like for you all to grab before we go into our group. Analiza is catching a flight, and she worked really hard with our group to get our presentation together, but she may not be able to join. She was boarding as we went into the second phase, but I don't want to leave that part lingering, because our section will deal strictly with the perspectives around racial healing circles. And so I don't want us to go into that while leaving some thoughts still in the chat. So there's one that says, does showing up as your full self mean fully engaged, feeling fully engaged and feeling joy and a sense of authentic safety all at the same time? So if the group could grab that one before we go into our presentation, that would be great, because I don't want to leave that one out there.
Anybody want to take a crack at it?
Sure, I'll try. I'll give it a try. I'll share my take on it. Yeah, I think our intention in creating the prompt of your full-hearted self was really because of how we're conditioned and how our lives are structured. Sometimes it's hard we're stuck right in this sort of cognitive intellectual domain, and what we really wanted to be intentional was create the space for us to slow down enough to connect with our hearts, and all of us are in a different place and in a different relationship and in practice to that. And so the intention behind the prompt was really for each person to tap into their own inner wisdom and inner truth about what does my full-hearted self mean for me, what's true for me. And so, I think that the invitation back is like, what is true for you? And that really being the most important way of making meaning and making sense. And I think that's what's so beautiful about the touchstones too, is that constant reminder in several of the touchstones around our inner teacher and our inner truth is really what's most important.
So I think that's great. For our group, and that's what I think our group wants to touch on. If Amanda, if you could start sharing our slides. This is an important section, because I want to throw in my caveat that I'm not trained in healing circles. I serve as an evaluator for our TRHT team here in Mississippi. And so I've had the opportunity to talk to participants from an evaluator side of healing circles, but I am not trained or have. I think the first one I participated in was the one at the actual convening. And so there's another perspective that we'd like to bring to the table and offer as perspective on how people see them and how things can how sometimes these settings can be really challenging if you're not prepared to handle the setting in which you're trying to create this safe space. So to the next slide. Yeah, so this is our group. Again, Analiza had a travel conflict, but we wanted to just kind of go through, who we are and look at an overview of healing circles and give our personal examples of our participation or how we engaged in healing circles and offer up just some conversation with everyone around their perspective, with dealing with healing circles as well. Because I think that for me, particularly, I'm interested to learn a lot more because while we just had a great example of connection and safe spaces and guidelines and all of those things, it doesn't happen all the time, right? And I think that we need to have that conversation also around, how these things can be challenging. These safe spaces can be really challenging if the facilitator is not completely prepared to handle that space, right? And so, so this is our group: Christian, Brother Leon, myself, and Analiza. Anyone from our group, Christian, Brother Leon, that you all want to add to this before we jump into our presentation?
No, I think you covered it all on my end.
All right.
Let's rock and roll.
All right, let's go. Next slide. So on down. So what we like to do is understand first that healing circles are, structured, supportive gatherings designed to facilitate open dialogue about racism, and the impact of racial trauma. The goal is to create a safe space and to share their experiences, feelings, and insights related to race and healing. And I think that the touch points that we got as sort of a guide for that was offered by the group before can really help contribute to some tangible safe space items that people can really touch on that doesn't seem too far out for them to grab, right? Even if you haven't had the background or prior experiences with healing circles. Next slide. So Analiza had some notes that she put together around these tenets, particularly around what is a safe environment. She talked about a safe environment being establishing ground rules, and those ground rules should promote respect, confidentiality, active listening, and ensure all participants feel secure sharing their thoughts and experiences. And also facilitator support, that the trained facilitators should use guided discussions, navigate sensitive topics, and maintain a constructive atmosphere throughout the circle. She talks about storytelling and sharing, and that the circle should encourage open dialogue, foster an environment where participants feel comfortable sharing their stories related to race and identity, emphasizing the importance of authenticity in these conversations. And this should also promote active listening. Active listening highlights the value of truly listening to one another without interruption or judgment. And we saw a touch point, anchored in that, which builds empathy and connection among participants. Personal narratives emphasize individual experiences, invite participants to share their unique perspectives and experiences, which can deepen understanding and challenge stereotypes. And create empathy. Personal stories allow others to relate and connect on a human level, enhancing collective healing and awareness. And then reflective practices. Incorporate guided questions and prompts. And again, because I'm not exactly trained in this, and some of the things I'll be discussing in my section is how some of these things sort of can fall through. And so when we think about like reflective practices and these guided questions, use prompts to encourage participants to reflect on their experiences with race, identity, and community, facilitating deeper insights and collective reflection. Allow time for group reflections on themes and emotions that arise, fostering a sense of shared understanding and process of feeling. Healing focus, acknowledge trauma, recognize and validate the emotional and psychological impacts of racial trauma on individuals and communities, and foster community. Acknowledge historical and systemic context. And this is one that was quite challenging for us here in Mississippi, that I think that some of our groups here fail to recognize the historical context of where some of the trauma was actually anchored. And how that got lost in the translation in that conversation showed up and how participants saw shared experiences. And so maybe we can touch on that in the open Q&A. Acknowledge these action-oriented outcomes, encourage participants to brainstorm actionable steps, and cultivate commitment to change, and diverse participation, promote inclusivity, and celebrate differences. Strive to include voices from various racial and ethnic backgrounds, and acknowledge and respect the unique experiences and viewpoints of all participants. And so now these are our suggested practices. However, we want to now get to some of the challenges, and I wanted to let, after I touch on this, let our group members sort of share their personal experiences with healing circles. So next slide. So she talked about some of these challenges, which is resistance to participate, the readiness levels of participants. So these talking points where some individuals may be hesitant to join due to fear or discomfort or lack of understanding. And so varying levels of readiness and emotional vulnerability. While we got an opportunity to set up and connect with a partner in the last exercise, I think it was beneficial to go back to that same partner, but that was an intentional action and not happenstance, and it could get lost in a person that's trying to replicate what just occurred. And so voicing those things and those intentional steps, I think, is absolutely necessary. And then sustained engagement. So when we think about, how we, move in this, there has to be some skill levels that's adapted from the facilitator that is viable for the group and their understanding of the participants that's in that shared space. So I want to pause there because I don't want to just run through and talk at, folk. Are any one of these things that you all see that sort of stick out to you in terms of challenges? We talked about the upsides and the benefit, and we know that there's value added to racial healing circles, but do some of these challenges actually stick out in some of your experiences with healing circles in your space?
That's right. Good yield, by the way, and thank you very much, Dr. Rodney. Dr. Rodney, that was amazing. Great presentation, great overview. Wow, now it's on me to actually talk about these healing circles. And, many years ago, actually, I experienced a healing circle, but it wasn't called the healing circle at the time. Back in 1970, I'm going to age myself out now, but back in 1971, I was involved in many ways, a healing circle. And it was in my hometown of Boston, Massachusetts. And it was during the beginning of school desegregation.
Oh.
And Dr. Cobbs, Dr. Greer and Dr. Cobbs from Harvard University, they had a program called Racial Confrontation Workshops. And it was to confront racism in Boston, Massachusetts, and around the country. They had these racial confrontation workshops. But in confronting race, or addressing race as they called it, they use many of the principles that I see here and locked down here today. All that to say is that that's the reason why I'm here today, is because there's another issue that has to be addressed in this platform, this idea of actually training people around healing circles. Training us around healing circles is critical for the work that I do today, and that is in the issue of health equity, diabetes in particular. I have an interest in making sure that we get an opportunity to have conversations around health equity, particularly between the African American Diabetes Association that I co-founded and the American Diabetes Association, who I believe has not done what it needs to do around issues of race and health equity, particularly around diabetes. So my interest is to make sure that we conduct a racial healing workshop with the American Diabetes Association and the African American Diabetes Association. Now, the question is, when do we do it? As soon as possible. Who can facilitate this? Well, I don't have, as my good friend, Dr. Rodney indicated, that's not my skill set right now. So we got to bring in the best and the brightest into that conversation to facilitate that type of deep level circle that is necessary. And what are the anticipated challenges? Oh, there are many. Actually, right now, I'm having a conflict where the American Diabetes Association is challenging the African American Diabetes Association's name. They have said essentially that the African American Diabetes Association has to change its name. So, are we not American and we are not diabetic? How dare you say that we should change our name from, African American, because they feel as though they have ownership of who is American and who is not. So we got some deep challenges ahead of ourselves, and racial healing circles may be an opportunity for change.
Thank you for that, Brother Leon. And I want you all to kind of take note of some of the things that said in these examples so we can leave some time for discussion toward the end. Next up, we have Brother Christian.
Awesome. Good afternoon. I'm going to go to the next slide. Thank you, Leon. Thank you, Dr. Rodney. So these are the questions that we pose. Why did we choose to conduct a racial healing circle? Who was there? When did we do it? How did we facilitate the circle? And what were the challenges? Next slide. I am pretty confident that everybody that's on this call has probably done a racial healing circle and didn't even know that they were doing it. And so we will talk about that later on. For myself, I live in Lancaster, California. You can Google it if you want to. It is a very conservative town. It is a very, it comes from a historical background of white supremacy, voter suppression, and operates in the spirit of anti-Blackness. And so right now in CA 27, it is a flippable district, so it's primarily purple right now. So we're trying to convert it, change it, especially right now in the election season. Just for myself, just heavily working on the different campaigns and in the political world. There is a need for change in Lancaster, Palmdale, Antelope Valley. And so I'm really excited because this healing circle allows us to really build, especially around the empowerment of youth and young adults, for youth and young adults, and around reparations. And, in Lancaster, Palmdale, there's a heavy population of white Christian nationalists. And so you can imagine who they're going to be voting for, whatever. But in the reality of it is, I'm literally in a war zone right now for our youth and young adults. Next slide. So with that being said, I started this fellowship. It's called the Bayard Rustin Fellowship. It's a civic engagement fellowship. And so what I did is I incorporated racial healing within one of the week's training within the fellowship, and didn't even know we were going to be talking about this. However, we made it work. It works together. And so we have about 10 young adults from all over Lancaster, Palmdale. They come from foster care systems, system impacted systems, educational systems. Some are at the college, and some also work as activists and organizers. And so with this, they range from 16 up to 24. Usually I work around with the TAY population. In California, we're called TAY Youth, Transitional Age Youth. In some other states, it's different language, but for the sake of today, I'll use TAY. Next slide. So that was the who. How did we do this? We facilitated, how do we facilitate the circle? So we would use the fellowship as a pipeline to conduct this. We were able to use it like boardroom style, circle style. What I did was allowed guest speakers from the nonprofit space, education, and political world to come in and to help heal, to conduct those conversations. Specifically throughout the fellowship, there's a curriculum that I built out, and one is talking about culture, so one is talking about public speaking, one is talking about history, as well as what is it called, anti-Blackness. And so for us, as we were leading up to the Racial Healing Week, this allowed us to really build that camaraderie and also build a relationship amongst one another, to build a trusting and as well as a healing circle to a certain degree. And so within that, next slide. I know you guys don't have it on here, but I got the updated one. So my questions that I asked, so forgive the translation of the slides. There were about 5 questions that I asked. One was, can you share a personal experience where you felt your race or ethnicity significantly influence how you were treated? 2, what do you believe is the most misunderstood aspect of your racial or ethnic identity? Number 3, what do you see as the biggest barriers to racial healing in our community? Number 5, what does a healed community look like to you? And what steps do you need when we can get there? Number 4. And then number 5, what role do you think community plays in fostering and healing among different racial groups? For where I live at, there is a huge divide even amongst the Black community. Some people can be bought out, as they say, all skin folk and kinfolk. And then you also have the brown community, you have our white community. So for us, really trying to bring that into conversation was one of the things that has been heavy on my heart, especially around figuring out how to not just flip the district, but also to bring the resources to bring a actual healing to the divide that have been plaguing this area for so long. And so I'm using this, and I'm not even what is it called, practically trained in racial healing circles, so anybody can do it. It's just about getting the proper questions. You can learn how to talk about, especially as a teacher, as a professor. This is something that we do. I do this every day in our work. You know what I'm saying? And I'm sure that some of you all do the same thing. And not even recognizing that we do it. Going over to the examples of the challenges, my challenges is, one is the age, because it's so young. You know, does it really offer a true perspective? The vulnerability, there are some folks that may not feel vulnerable to talk about it. Lack of all races, predominantly our fellowship was predominantly Black. We had a few Latinos and 1 white person. And then also timing and commitment, trust issues, making sure that there can be trust issues, and then also involvement from the city. I think sometimes when we are combating the status quo, you will not get the most buy-in. And so it's out there, and I'm looking forward to doing more, to expanding more on it. And so that is an example of my racial healing circle. And yeah, that's it. Thank you for your time.
Well, thank you all for sharing. I know that's our time. I appreciate it. I'll turn it back over to our facilitators, Monica. And thank you, Armand, for guiding our group through the technical sides of it.
Thank you all so much. This was really, really wonderful, very rich and wonderful. So thank you all.